Namaskar. Welcome to Samvaad at Arunima Ankuran. On the occasion of World Health Day, we are having a conversation with Dr. Anurag Kumar, a neonatal and pediatric surgeon. It's a privilege and pleasure to have you here with us, Doctor. Thank you so much for joining in. A word about Arunima Ankuran. Arunima Ankuran is an initiative for positive social change through self-development. The goal is greater well-being and happiness for all. At Arunima Ankuran, we believe that each person is unique and special in some way, that each person can make an impact, that each person can make a difference, and that's what we celebrate every day. So the World Health Day is celebrated on 7th April every year to mark the anniversary of the founding of WHO in 1948. Each year, a theme is selected to highlight a priority area of public health concern in the world. On World Health Day 2022, in the midst of the pandemic, a polluted planet, increasing diseases like cancer, asthma, heart disease, WHO will focus global attention on urgent actions needed to keep humans and the planet healthy and foster a movement to create societies that are focused on well-being. So we will talk to Dr. Anurag Kumar about so many other things, but to begin with, let me ask you to introduce yourself.
Hi Pragya and hi to everybody else who will be listening to this. I'm Anurag. I'm a doctor and an MBBS and MS from King George Medical College, Lucknow. That's a place I joined way back in 1977. So we are Georgians of the 77 batch. Finished my MBBS, finished my MS from the same institute. Then actually I went back to work in a place called Jamshedpur, which I'm sure you would have heard of. It's the town of the Tatas. I worked for a good 12 years before deciding that I want to do pediatric surgery. And that's what took me to Christian Medical College, Bangalore, where I did my MCH in pediatric surgery. That was in 2000. And since 2001, I've been in Bilaspur, working initially as a full-time consultant at Apollo. But now I'm only a visiting consultant, but I'm working at many other hospitals in this city, and by God's grace, fairly busy. I've written a book of short stories. They are related to the work I do, the people I meet, the patients I meet, their reactions, the reactions of the doctor, and I've compiled them. There are about 30 short stories. They're compiled together in a book called Bipolar. It's a strange name. There's a story. There's not much of a story behind it, but there is a reason behind it. And one of those stories has also been converted into a short film. It's a 17-minute film. We got together with a team of photographers and actors and shot that film, which went on to win an award at the Raipur International Film Festival in 2019. It was, I think, just before the pandemic. So that's about me.
Thank you for joining us and thank you for sharing the milestones of your journey so far. For us, even just to imagine doing surgery on little babies, talk to us about your work.
It requires special training to be able to operate. We are basically using almost the same instruments as general surgeons, but we are different with our skills in the way we handle tissues, the way we perform the whole surgery itself, and far more importantly, in the way we handle the parents of the child. Because for them, child is a defenseless, helpless person, and imagine their own child being operated on within a few hours of birth causes a lot of anxiety, creates a lot of questions, and quite a bit of time is spent, and rightly so, in handling that aspect of the surgery. You can't deny, you can't just focus on the surgery and say, I don't want to do that.
Hmm.
That is equally a part of surgery. You have to treat the entire family. So that is there even for bigger children or even for adults. There are times when patients come with just a report, but it is going to be operated, and you tell them yes, but then you always want them to bring the patient. The visual assessment of the patient is necessary, not only the report, not only a visual assessment, but complete examination of the patient. If you're going to treat the entire thing, you know that there are people who you show them one needle and they become unconscious. And there are people you show them one needle and they say, "Yeah, come on, give it."
Hmm.
So one has to assess the entire makeup of the patient. As far as neonatal surgery is concerned, the entire makeup of the family. How are they going to react? What am I supposed to tell them? How much will they tolerate? What will create so much of anxiety that they refuse surgery?
Hmm.
What will create that much of reassurance that yes, let's get the child operated? So neonatal surgery is not only the skill of operating on a small child, it also includes the skill of involving the family in the treatment, taking them into confidence, reassuring them. That is also an equally important part of neonatal surgery, pediatric surgery.
So, what are some of the issues for which you usually have to get a baby on the operating table?
There are some issues which are evident at birth, and anybody knows that yes, this child needs surgery. Uh, but a lot of times we are operating on children who have problems inside. Uh, some of the things that immediately require surgery is some part of the food pipe is not made, is blocked, or some part of the intestine is not made, or blocked. Uh, so those are children who will never, the one with the food pipe that is blocked, that child is never going to be able to drink milk because the moment he swallows, he will either vomit it out or it will go into the windpipe and he will drown the milk. So that is a emergency. You need to operate. Sometimes um, children have, babies have abdominal content, things that are supposed to be in the abdomen. This time they move up into the chest
Hmm.
during pregnancy itself.
Oh.
So the child is unable to breathe. That is an emergency which you need to operate. Take the intestine out, close the gap from which it has gone in, and hope that the lung expands and the child can come back. So there are a lot of internal problems which are immediately life-threatening and need immediate surgery. Then there are others which are not immediately life-threatening, which are more of cosmetic nature. They have a certain time frame on which you operate. They are planned surgeries, they're not emergencies. Uh, but yes, neonatal surgery is the most challenging and it is developing fast also. In fact, all branches of surgery are developing fast with the merger of engineering and medical knowledge. You are getting things like laparoscopes, you're getting robotics into surgery. So technology is blending well with medicine and together coming up with newer and newer innovations, which will be endless, which should be endless also.
Which is the youngest baby you operated on? What age?
Within a day, less than a day old. I mean, it is for to be honest, we're all trained. I have a friend who was a fighter pilot with the IAF, and we were driving down in the car one day, and so I was sitting by his side, and he was driving. And I'm thinking, how did this guy fly a fighter plane? I mean, at supersonic speed, and he's all alone up there. So I asked him, "कैसे करता है यार?"
Hmm.
He said, "That's what I was thinking. How are you operating on small kids?" But I think the common answer to that is we've all been trained to do a certain job. he has been trained to fly a plane at supersonic speeds and fight. And I've been trained to do this. So depends on each one's training. So yes, it sounds challenging to you, but your job sounds challenging to me. I think I was discussing with you a short while back that I don't know how to do this. I'm absolutely new at this, and you gave me the reassurance. That's the kind of reassurance I gave to my child's parents. Yeah, ho jayega. You don't worry, we'll manage it. So I think each one of us is specialized, trained in a particular way, and my glory is not greater than yours and or the fighter pilots. We're all in this doing our own job. That's how things go.
Now that you're talking about training, it brings me to the aspect of teachers and trainers. What has been the role of teachers and trainers in your life so far?
I have learned not only from the teachers as defined by the book, the teachers who teach in schools and teachers
Hmm.
who teach in college. I think teacher is somebody from whom you're learning. So the first teacher you come across is your mother or your father. Their mothers and father, the parents, they are teachers. And I learned a lot from my parents, from my mother, from my father. And just to tell you one of the first stories I remember about my dad. He was a warden in one of the hospitals in BHU. And this is what my mom tells me. My dad never tells me about what he has been doing. But this is what my mom told me. There was a party in the hostel for at the end of the year when everybody had passed. And there was an invitation for my dad. Um, so he accepted the invitation, but then he found out that in that whole batch, there was one person who didn't pass, didn't clear the exam. But for all the others, there was a party going on. And my dad, when he go to the party, he went to that one fellow who was alone in his room, sitting with him, sort of sharing his pain while the party was going on downstairs. So that those are things that I learned from my parents. Teachers actually have a very important, in school, we had a couple of teachers, couple means husband, wife, they used to teach us Hindi.
Hmm.
And we all, the whole class, we got together again after so many years, thanks to internet and email and WhatsApp. And suddenly we realized that the Hindi teacher, the gentleman, he was unwell and he passed away, maybe about 10 years back. So we thought of sending the lady a plaque on which we would write some messages for her and for her husband. Nobody wrote about आपने हिंदी हमको अच्छी पढ़ाई किसी ने नहीं लिखा. Nobody wrote about how good or bad he was at Hindi. Nobody wrote at all. What people wrote, and these are people who are different corners of the world sending in emails to one person. Please write this on my behalf. Please write. What was written was, I remember, I mean, uh, the book that we had to read as part of our studies was a book called Gaban. You must have heard of it. Premchand ji ki hai, Gaban. So the Hindi teacher would come and teach us Gaban, and there was part of the story was where the protagonist embezzles a lot of money. And the people who wrote that, the disgust in your sound, in your voice, in your manner was so much that we knew that this is something that is absolutely a no-no. There's nothing to do with the story. It's how he has been, the story has been presented by the teacher who's reading it out. He created such a lot of disgust for this kind of thing. There was another person who wrote, when the emergency was declared, he came to the class, but he did not teach from the book. He was so agitated. He was so agitated at the loss of freedom, at the loss of liberty. He spoke at length about the importance of freedom, the importance of free thinking, the importance of being able to speak. We realized that that was something far more precious than the book you were supposed to teach.
Yes.
So teachers teach not only the subject they are allotted, but their mannerism, the way they behave. The child sees the teacher jumping a red light, gets there, he knows, and he might, for all you know, might want to emulate that. So that is the importance of teachers. So these are just some of the, and I learned from friends also. I learned, oh yes, I must tell you about my hockey teacher. He was not a teacher.
Hmm.
He was not in school. He was a group of kids playing hockey at home in the colony. There was one gentleman who used to come and he was fond of games, so he would teach us. Sardarji Dev,
Hmm.
he used to teach us hockey. I was a kid at that time, very small. And there were a few others, much 4 5 years senior boys with us, and we used to play hockey. Or whenever I would see one of the bigger boys coming down charging with the hockey stick, I would be scared. I would back off. दो तीन कदम पीछे आ जाते थे इसलिए मार देगा. From across the field, the gentleman would notice, and from there he would shout, "Chadina, Chadina, लगा रहे शेर को तो छड्डीना." उनकी आवाज सुनकर I would pick up my hockey stick and I would charge. Mostly I would get run over. One bigger boy, but yes, sometimes I would get fall. Now, how this is important is when I told you my MBBS, MS, I said there was a gap of about 12 years between my MS and my MCH. Some of that time I spent doing surgery, and once I realized I have to do pediatric surgery, it took me about 5 attempts getting to a medical college, giving the exam entrance test. Every time I would go, give the exam, go to the notice board at the end of it, and I would see, yeah, there are now. Yes, I've not been selected. And I would go back thinking, forget it, it's not for me. कहीं से वो मैदान में से आवाज आती from the hockey field. From the hockey field, I would still hear that sound, Chadina, Chadina, लगा रहे.
Wow.
Next year I would give the exam again.
Lovely.
Again, I'm not there on the notice board, and again I would go back thinking, what the hell? Let's give it up. मैदान में से आवाज आती, Chadina, लगा.
Oh.
Right. And that has stayed with me, even in the profession. There are times when you know that this patient is not going to make it, he's too ill, and you want to sort of give up. ये आवाज आती है, Chadina, Chadina. So you keep at it. Yeah, many times you get run over, but one or two will survive.
Yes.
That is the importance of teachers and how they influence so much in life. And teachers, not by definition in school or college, teachers, anybody who you have learned from, your children, they teach you so many things.
Yes. So you just said that, sometimes you know that the patient will not make it, but you're still going on. Is there a specific story that you can think of and share where this happened?
Uh, yes, way back in Jamshedpur, there was a time of election. There were cars moving around. One of the cars, ambassador, stopped at a place in the field. And there were little kids playing football in the field. One of the kids went to pick up the ball which was near the car or under the car. The child had bent down behind the wheel, behind the rear wheel, and the driver didn't know that the child was there. He put the car in reverse and turned. Then the child's head came under the wheel, not totally, but he was injured badly. Parts of his brain were coming out. There was no neurosurgeon in Jamshedpur at that time. We were general surgeons and we took him up for surgery. And since the brain had all come out, we kind of almost gave up. We thought we would make it. It's too bad. But something kept us going. We have to operate. Let's do whatever we can. We don't know what the outcome will be. We must. So we went in and operated. We had a very rough post-op time, and again, all the time, we were thinking we might as well call it off. Even if we survive, we'll be a vegetable. But these things are never in our hands. Just because we didn't give up, we kept on, kept at it. The child survived, it became all right, and you would be surprised he didn't have any neurological deficit. He was very alert. The only thing he had was some infection in the bone, which was easily treated later on. He's perfectly all right. I struggle to think what would have happened if we hadn't operated on that child at that time, thinking, it's over, let's get it up. So, persistence is a virtue. You have to keep doing what you want to do or what you have to keep doing it. You never know what will does.
So when you're, working so hard, I'm sure it requires a lot of physical stamina as well as mental strength to be a good surgeon, working like that. So how important is it for a doctor to remain fit?
Why only a doctor? I think it's very important for everybody to learn to remain fit. And I learned it the hard way.
Hmm.
What we're talking, the importance of fitness, I learned in uh, about 10, 12 years ago. I didn't realize that it's not in our customs to say keep you're looking fat,
Hmm.
but I had become fat. I didn't know it. We, these are grams being added every day, and suddenly you are 90 kilos or 100 kilos, and you don't know you develop hypertension. I was lucky. I had a friend who saw me after many days and said, "Oh God, you gained such a lot of weight. Let me check your BP." And he checked my blood pressure. My diastolic was 110 and it would have been 80. Lower blood pressure. Then suddenly I saw all those cases of my patients who have had strokes with hypertension, blood pressure. Then I realized if I get one of those, then my surgery is gone. So I was told either you lose your weight or these other medicines. I won't touch the medicine. And I worked hard at it, lost weight, not by God's grace. I'm not on any medication now. And I'm able to work, as you said, for long hours. Fitness is important. If you're fit, you're able to think in a different way. You're able to work in a different way. And fitness gives you a sort of fortifies you against so many different diseases. As a doctor, as as a human being, you have to work hard, strive to remain fit. That's what we've been doing. And so far, it's been all
Mhm.
right.
You have a very busy schedule, like most doctors do, but in spite of that, you managed to write a book. So, where did the inspiration of writing a book come from, and how did you find the time to do it?
No, no, there was no inspiration.
Hmm.
There was no inspiration. You see, medical profession is very emotionally demanding profession. Have you heard of a term called second victim?
Hmm.
There's a term called second victim. Something goes wrong with my patient. He's the first victim. उसको अगर कुछ हुआ, may not be I don't know. All doctors do their best to save and protect the life of their patient, but it's not always in our hands.
Hmm.
The results are not favorable. When the first victim is the patient and his family. Not many people think about the second victim.
Yes, very,
Second victim is the
very true.
doctor. Second victim is the doctor. If you think कि मेरे पेशेंट के को कुछ हो गया तो सिर्फ उसी के घर वाले रात भर जगते हैं, नहीं, ऐसा नहीं है. जो डॉक्टर है इसके इसके ऊपर जितनी फेथ दे के लोग आए, he feels he has let them down. Whenever I felt like a second victim, I have to give vent to my emotions. So I would scribble it out in bits of paper. Yeah, जिसके साथ ये हो गया, उसके साथ वो हो गया. And I have two daughters. My younger daughter would collect some of these bits of paper. One fine day, she showed me about 10 of them. They were written on paper napkins from restaurants while you're waiting to eat for the food to come. Somewhere in some diary, so most of she put them all together and said, "You've got 10 now. What are you going to do about it?" I don't know anything about that. But then one of my friends came and said, "Why don't you do something? These are common stories. All of us go through it." So by that time, I written a few work, and we got together, we compiled it together, we published it as a book. It was not intended to be written. It got wrote,
Mhm. Yes.
only great. It was for me to dissipate my bad hormones and get rid of all the stuff that was on in my mind as a second victim. And that got published as a book. Full inspiration नहीं था, अगर कुछ inspiration था तो it was the surroundings, the patients, all those things. But I never thought that I'd be an author one day and I'll write a book. And no, it was not like that. I just want to get rid of it.
And what about the movie you made?
Yeah, that movie is from one of the stories in the book.
Hmm.
A lot of my friends read that particular story, friends from the medical profession, and they said, "Where have I seen this movie? So have you written this yourself?" I have seen this somewhere. I've read it somewhere. I said, "No, you've not read it. You've lived it." Because that is what we all went through as doctors and training for medicine. Everybody felt that this is nothing new. तो हमारी कहानी हमने कहीं ना कहीं तो पढ़ी है, हमने पढ़ी नहीं है. You have lived it,
Hmm.
and then that particular one was so much appreciated. I thought I must make a film of it, and I had bit of an inclination towards stagecraft acting, things like that when I was in college. That was the teaching from my mom again, since we go back to teachings. My mom had a very creative kind of attitude to everything, whether she was in the kitchen or anything, embroidery or anything, whatever, music, very creative. So we decided to make a film, and 2019, it was very interesting, making films. एक तरफ प्रोफेशन है अपना मेडिकल वाला, दूसरी making a film is completely different. So anything that is completely different out of your usual form becomes very interesting. So that film is there. I hope you get the time to see it, and I hope there's a YouTube. It's there on YouTube.
Sure. What are some of the most memorable experiences that you have had as a surgeon? Something that really inspires you to keep going and keep doing the good work.
See, at the end of the day, you don't look for a document or recognition. What really inspires me or drives me to do better is when a child smiles at me on the road.
Yes.
उससे बढ़िया और कुछ नहीं है. And very often I don't remember who the child is and why he's smiling. And then the parent would look at the child and then they look at me. Oh, you remember this one?
Mhm.
This child you operate. उससे बढ़िया और inspiration है ही कहाँ?
बिल्कुल बिल्कुल.
That gives you such a high, that it is unimaginable. Absolutely unimaginable.
So we will ask you to share a message for the community from on this occasion on World Health Day. What would you like to say to the people who are listening in?
Yes, the most important thing, one of the things that we learned, one of the words that we learned in the pandemic, frontline worker. And it has been made out that the frontline worker is the person in the hospital whom you meet first. Frontline, the one who will take care of you immediately when you reach. I think the frontline has shifted. Frontline is now the person himself. Yourself are your frontline. You have to take care of yourself. First, you take care of yourself. You take care of yourself. You don't need to go to anybody else. You've seen this during the pandemic. You've seen clear-cut instructions being given about distancing, about masking. You've seen that people have not followed it as well as they should have. And then they go to their frontline worker who takes care of them. But frontline worker to yahi hai. You have taken care of yourself with your mask, with your hand washing, with all that described, and now with the vaccine. Then you won't need to go to the second line worker. No? Yourself are the front line worker. You have to take care of your health. I don't know how many more waves that you got the pandemic now. I do hope it is over, and I do hope that this is the last one that will ever happen. But all said and done, we still need to take care of ourselves. That is most important. So work hard at your fitness, everybody. Take care of yourself and the rest. God will take care.
Thank you so much for spending this time with us and talking to us on Ek Samvaad. It was a pleasure having you here. Arunima Ankuran is grateful to you and wishes you the very best in your journey onwards. Thank you.
Thank you. Thank you. I enjoyed myself. I enjoyed talking to you. And I enjoyed the way you provoked me to get things out of me which I never knew I would be able to talk about. So, uh, digging back into my memories, digging things out. Very nice. I enjoyed myself thoroughly, and I hope you did too. And I hope all
Yes.
the people who watch this will also.
Yes, I'm sure they will. Thank you so much. Thank you.
Thank you.